Hello and welcome to the Voice of the Patient podcast. We are the podcast working to change lives, that is, improve the quality of life through not only hearing, but truly listening to the voice of the patient.
Hello, everyone. Thank you for downloading this episode of the Voice of the Patient podcast. I'm excited to hear your thoughts about this episode with Mandy Chamberlain. We really had an awesome conversation talking about how physical and occupational therapy have so much in common and how we really share so much passion for just trying to serve people and to try to really offer the most we can for humanity. And it was just a really fun conversation, and it was just so easy to talk to someone who obviously cares so much about other people. Before we do that, I just want to offer a couple announcements. And first is that the Voice of the Patient is officially part of a network of the Geros Collective. You can find more about the Geros Collective at geroscollective.com. And one of the podcasts in the network is Mandy Chamberlain's, which is Seniors Flourish. And another announcement is I'd like to mention that the Voice of the Patient is proudly sponsored by Covalent Careers. Covalent Careers is a personalized career development platform for healthcare professionals. By providing career educational resources, mentorship, and job placement opportunities, Covalent Careers helps you design the career you want so you can deliver the best possible care to your patients. The best part is that it's free to join. You can set up your own profile today, and if you do so, make sure you use the code SMITH2017, and that's Smith in all caps. If you're an employer, we've got your back too. Join Covalent Careers today, and you can access thousands of motivated, compassionate healthcare professionals who will help you take your workplace to the next level. And if you're an employer, use the code VOICE, and that's VOICE in all caps. Thank you, and enjoy the episode. Hello, everybody. Thank you for downloading this episode of the Voice of the Patient podcast. Today, our guest is Mandy Chamberlain. Mandy Chamberlain is an occupational therapist and the founder of Seniors Flourish, where she blogs, podcasts, and hosts a learning lab for occupational therapy practitioners. She earned her Master of Occupational Therapy degree through the University of North Dakota's School of Medicine and Health Sciences and decided to focus on community-based medicine. She has a varied clinical background working with geriatrics through home health services, home modification consultation, long-term care, assisted living, inpatient critical access, and outpatient therapy services. She now works and consults in the mountains of Colorado. Mandy, thank you so much for coming on to the Voice of the Patient.
Hey, thanks, Zach. I'm excited to be here. It's just going to be fun.
Absolutely. Well, so let's just dive into your career as an occupational therapist. Could you talk about how you serve patients as an occupational therapist?
Yes. It's a crazy little background. I think it just depends on where you're working, your own therapy journey and all that thing. But when I graduated from college, I moved to Colorado, which is, a rural area. And I actually started in home health. So I worked home health right away, which some people, that's maybe not the ideal situation, but I fell in love with home health. I wasn't sure if I would, and I was really nervous, but I just started in home health and it was great. So when you work like in a rural mountain community, you end up being a little bit of a jack of all trades, right? Like you're doing everything. You might be the only OT. And so in many, many of my facilities, I was the only OT, or maybe there was, I work with I've worked with some great codas, so it just kind of depends. So then from there I went to outpatient in a critical access hospital. So I did outpatient, orthopedic, neuro, everything kind of on the whole umbrella of OT, inpatient. And it's just like you kind of do everything, program development, oncology, rehab. I mean, it's just like I've dipped my toes in a lot of different areas in the last 14 years. But now I do see, what do I do? That's a really good question. I do a little bit of everything. I have 3 young kids, and so I wasn't able to work part-time, which is what what I really wanted to do, but I definitely wanted to stay, in the clinic and stay with the patients. So currently I work PRN at like 3 different facilities, skilled nursing facilities currently. And then I also started seniorsflourish.com out of basically necessity, my own necessity, purely, self-needing. I was at home. I wanted more clinical. I just wanted more professional camaraderie. I felt like OT, we were kind of lacking that. And there was so I started the website. I just was like, I'm going to start a website and try to get, some more information out there to the world. I was kind of focusing originally on caregivers, like but then there was all these OTs that were reaching out to me. And I was like, this is such an amazing way to be able to serve my patients in a whole different way. I can help, support and mentor and give ideas to other, occupational therapy practitioners, which translate to them feeling not burnt out and excited about therapy and, just kind of getting creative again. And so I was like, that's a really neat way that I can help serve patients in a whole different way, in addition to my clinical practice, because I still do it because I still love it. And so I started the website. I just needed some kind of outlet. So I just kind of started there, and it's developed into, like you were saying, I created the Learning Lab membership site. So it's kind of like a mentorship program for other OT practitioners that just need a little bit, that were just like me, like when I started, being kind of alone or not having that support in your facility, where you can get ideas and bounce ideas off other people. Like we do it all the time in the clinic. You're like, I have this patient that's X, Y, and Z. And like, do you have any other ideas? Or I think more brains are better than one. So it's like, what's the best way we can do that? How do we serve our patients the best? How can we provide the best care? How do we, stay as evidence-based as we can? And so I felt like that was one of the ways to do that. And so that is how I'm serving my patients currently. So it's I do a little bit of everything, which I like to keep things moving,
Right. Right. That's awesome. And I can say that I love that idea. And I imagine that there are just so many practitioners who really appreciate the work that you do, because like you said, you might find yourself in a setting where you don't have the chance to immediately bounce your ideas off of another clinician right there. And so that's a big fear, I think, that a lot of clinicians have. At least it was a fear that I had going on internships. I just graduated, and on some internships, you have this great little community in the clinic to be able to sort of have a checks and balances of your practice. And if you have ideas and you want to try them out and bounce them off of another clinician with more experience, but there are other clinics where you're kind of on an island. And that's a scary thing, because no one's really this perfect clinician all the time with every type of patient. So it's really awesome. And I can see how so many occupational therapists and occupational therapist assistants really appreciate that service that you provided. So going back into occupational therapy, what inspired you to pursue that career in occupational therapy?
Well, I started, like you go to college, you're not exactly sure what you want to do. But I started out going down the social work route, which actually, if you know about social work and if you actually know about like the theory and basis of occupational therapy, there's a lot of parallels. So you're really obviously helping people. You're really getting down to what they really need and that kind of thing. But I started in social work, and I grew up in a sandwich generation. So like, there's 4 kids in my family, and my grandmother passed away, and my grandfather was living with us. And we had this little trailer on my parents' 10-acre farm so he could have his own space. It was like he kind of needed assisted living, but we just thought this was another avenue to have him close and we could take care of him. And we could spend so much time with him. And it was like such an amazing time of my life, because it was probably, I think, during my high school years that he lived with us. And then he had a CVA, he had a stroke. And it was one of those things, like I was there when he experienced that. And so I saw the changes before my eyes at the age of, 18. And you're just like, oh my gosh, crazy. And it just shaped and changed basically who I was. So I was like, okay, social work, not for me. And so I was introduced to OT because he had to go into a skilled nursing facility and he had, OT, PT, speech. So I was exposed to that because we were so involved, because he lived with us, we were so involved in his, rehab process. So I was just exposed to OT through that. And it kind of combined everything that I loved, that I was kind of interested in social work. Social work, I was really interested in mental health. And with OT, you can also work in mental health. So then it was like, I like the mental health side, and the cognition side, and then you have the physical side. And then it was like this big trifecta of everything that is me. And I was just like, this is perfect. So I, decided to go into occupational therapy. And I didn't, even in college, I wasn't sure if, geriatrics quote was going to be my focus area. And, I've worked, in so many different, areas of occupational therapy, and I've worked with all ages, except for pediatrics. I've never worked pediatrics as a actual licensed clinician, but I just always have a love for the older adult. I think part of it is just like I grew up with it, and he was such an important part of my life. And I see the value, and I see that I feel like it's a very vulnerable it can be a very vulnerable population that is not being heard and not being advocated for. And I feel like, okay, there's so many of us, let it be OTs, PT, speech, just the rehab team working with the older adult. And I feel like it's time for us to support them in other ways, just not just working with them, but like making them heard. And, like going back to the website, like there was when I started seniorsflourish.com, there's no other website out there that focused on occupational therapy working with an adult or an older adult. There's an amazing amount of pediatric occupational therapy websites because it's fun, right? Like you can do toys and games but like working with older adults can also be very rewarding, and it can be fun. It depends on how you make it, right? So like, let's get everyone excited about it again, because also the, baby boomers, there's going to be there's a huge population of older adults in our country. And it's like, we are going to be a forefront in the healthcare team, helping them be independent and, living good quality of life, keeping them strong, keeping them in their homes, doing what they want to do to live a fulfilling life, or as much as we can. So, I get really passionate about, occupational therapy in the sense of, I feel like obviously, because I'm an occupational therapist, I feel like it's such an amazing field and that we can do so much. And so, obviously, I'm not, having my grandfather experience a stroke was just like devastating to my family, but also like it really opened a door and really inspired me and helped me pursue my life track, which is not what I planned, but it's been so good. It's been so good.
That's so awesome. Thank you so much for sharing that. It's inspiring, and I'm sure it speaks to so many. It speaks to me as in the same way I'm sure it speaks to those listening. Is that just really touches on what drives someone to go into any type of healthcare profession, and whether, whatever discipline it is. But it's about, you see someone who really needs some sort of service, some sort of help, and you feel like they're not getting it, or you feel like that they just need someone to be there to help them through this, whether it's rehabilitation or whether it's, some trauma, something like that. And to think like, I'm not happy sitting around and letting someone go untreated. And so therefore it drives you to say, I need to do that. I need to be there. And so I feel so many parallels in what you've mentioned, and I want to go back to what you mentioned about with mental health, wanting to go into social work. My first reaction is that I wanted to go, or I thought I wanted to go into clinical psychology for a lot of the similar reasons of treating mental health, really trying to be that empathetic, compassionate person for those who might be going through such a situation that there's not a whole lot of sympathy to go around for those people going through that issue. But what I had found, it didn't feel right. And I didn't know at the time where I wanted my passion to be, and for a similar reason of seeing others go through a problem physically, and say if someone, and I don't want to disclose who they are for their own privacy, but those in my family who they had this problem, and they couldn't do what they wanted to do. They couldn't do what they loved. And I couldn't handle the thought of them suffering in silence. And I think that speaks to a lot of those who are older adults who say, well, it's okay. I can't lift my arm up, but I'll be okay with one arm. And you say, like, that's not okay. It's not okay to only use one arm. And so to offer someone the chance to do what they love. And so then through physical therapy, it's similar to occupational therapy in that way, in that you can find yourself treating the whole person, not just this physical problem, but a lot of the emotional and psychological things that go along with that problem. And it's really funny, that you say this, because one physical therapist I worked with on internships, she said, I'm surprised you didn't go into occupational therapy because there's so much psychology in occupational therapy. And my first thought was like, well, yeah, there definitely is. There's psychology in like any rehab profession. And so it's just really awesome. And I love that you came from the area of social work. And it's also one of my previous guests, Emil Berengut, who's a physical therapist, and he actually was a social worker, and then went to PT school, and now he's a physical therapist and a social worker. So it's really interesting, but it all makes sense, because it
does.
It's the things that you really want to get better in a person. It's not just this cleanly delineated area of this is a physical thing and that's a mental thing. That's gone away. It's a centuries old way of looking at health that's just gone away. It's all about just this total, with the biopsychosocial model, it's the whole person. And so really through our different disciplines, we really have the same approach to that with just, we happen to have different degrees. So could you talk about what you've learned with this interdisciplinary approach with different providers who may have different degrees? What sort of things have you learned about that interdisciplinary approach?
Well, without trying to be idealistic, which I might be a little idealistic, but
I think that's a good thing.
yeah. I mean, okay. So talking about just interdisciplinary healthcare teams. Okay. So I think some of the problems where it gets a little hairy is that people actually don't understand what other disciplines do. And we like to hold on to our discipline because we all need to, show our own distinct value, and how we have to prove to insurance companies or whatever we're trying to prove to that we know what we're doing and we are the only ones that can do that. I totally understand that. And I believe that to a point, right? But our focus, if we can focus on the patient and we can work together as a team to achieve what the patient's goals are and what their needs are, we're going to thrive, right? So I think that there's such a misunderstanding of the other areas that other disciplines can do. It's like saying all PTs do is do exercises. All nurses do is pass medications. Right. All speech therapists do is, have them, swallow or say, vowel sounds. It's just like so close-minded to what everybody else is doing. And so I think there has to be a level of respect for each, health profession, and actually have an understanding of what that all entails. Easier said than done, obviously. But and also just admitting this area is not my specialty. How can I reach out to other people on the healthcare team to address that issue? I don't want it to get dropped. I'm not the one that can address that. So how do I get that, how do we get this accomplished? And so I think, some healthcare teams definitely work better than others. And there's a lot of things that go into that, right? Like there's, group dynamics and the way, the facility's set up, and is it easy to communicate, or, there's productivity demands that you don't have time to get over there. And I get it all. Like I've done a lot of it. But I feel like if we have a basic understanding, I actually feel like it's important that in school, which we're cramming so much information into our brains when we're in school. So, take this with a grain of salt. But I feel like if we had a basic understanding of obviously our own profession, but what other professions do to a point, like I feel like we'd be able to actually serve our patients a little bit. We'd be able to serve our patients better. And if we can actually even just listen, like your whole philosophy of this podcast is like, listening to understand the patients. It's also listening to understand our healthcare team and not disregarding what someone's professional opinion is. It's hard. I know they've been studying it and trying to figure out what's the best way to communicate. How do we do that? But everybody's stressed. They're trying to do their job. They're trying to serve the patient. And not that that's an excuse, but it's just like, we have to take that, ownership and really make sure that we are being, providing a team approach. So
100%. I'm sitting over here. I'm like a bobblehead, just nodding up and down. It's exactly how I feel. And it drives me up a wall when we start to, I get it too. Like you said, you have to sort of prove your worth as a provider.
Mm-hmm.
Otherwise, why are you there? Why should you be paid? I get that. However, so many problems are created by lack of communication or by refusing to care about the patient first. And then really it should be the team second, because since we need to work together to provide all of the different needs to that patient, that's when we forego that team approach, it's just going to be a complete failure. Either we're going to offer more services than are needed. We're going to offer the wrong services. We're not going to offer the right ones. That's how it backfires. So much of it comes down to not really understanding what other providers do to begin with, because there are these misconceptions. There are these sort of prejudiced thoughts of what different providers do. And for example, I see between physical and occupational therapy, I see weird little dichotomies that I was like, I didn't even think that was a thing. And then I come across a facility that like, okay, I see why they said that now. Like I see stuff like some people say, oh, occupational is upper extremity, physical therapy is lower extremity, or physical therapy is gross motor and occupational therapy is fine motor. And it's like that. Well, that's bizarre and nonsense. So now you have, with this podcast, primarily physical therapy practitioners. Many of them, maybe, especially if they're students, maybe they haven't really had a good enough experience with occupational therapy. To a physical therapist, what would you like them to know about occupational therapy?
Ooh, I love this question. Well, I think like it kind of like you were saying, it boils down to not having a good understanding of what we do. And because there are a lot of similarities, right? Like there are some things that we definitely, overlap in, right? And so I think what happens is that, because people see those overlaps and it's not how our own profession would do it, you're like, that's not right. Or, vice versa. And like some facilities are really amazing about working as a team. And some are very, like you were saying, this is what PTs do. This is what OT do. And if OT is doing something PT does, they're like, why are you, it's like turf wars. And then why are you walking? Why are you doing ambulation? I'm like, I don't know. It's functional ambulation. How else are they going to get to the bathroom or whatever you're trying to do? You're like, it's lack of understanding of what our roles are, and also a lack of understanding of what our educational background is. Okay. That's kind of what I think from both disciplines, or you can even throw in speech language pathology because there's a lot of overlap between speech and OT too. So my view and my take on occupational therapy, I'm just going to go from an occupational therapy standpoint. People can take with it what they want, right? But I feel that occupational therapy is very holistic, because what we're trying to do is we're helping people complete the functions of everyday life, to help the patient live, their life to their fullest. And for OTs, we're like, yes, that's exactly what we do. But what does that mean? Like, what does that mean? Dude, like, if I say that to a physical therapist, you're like, okay, yeah, that's great. Like, that's amazing. Or a patient, But like to an OT, that is our core. Like whatever we do, our focus is on increasing that quality of life and doing whatever we need to do to get there. Okay. So, we focus on the areas of, things that we need to do every day. Occupation used to back in the day. And that's why another thing is like, oh, it's such a hard thing because how do you change the name of a profession? You don't. But what occupation, the true meaning of occupation is the everyday activities that we do. That's all. It's morphed into meaning jobs and working. But like back in the day when OT started during the war and that whole thing, that's what it meant, the everyday activity. So let it be self-care, the basic, but people kind of think of OT to do, quote, do, eating, dressing, bathing, taking your medications, driving, those ADL, IADL activities. But then it's also things like productivity as in work, productivity as in if you're a student school, what are those things that, what is the productive part of your day? And then the leisure activities, that's such an important, if you're looking at someone from a holistic standpoint, we need to be looking at self-care, productivity, and leisure activities. And leisure activities can be anything from just like socializing to literally water skiing, right? So we're looking at the person as a whole being and trying to figure out what do we need to do to help them function and increase their quality of life. That's, again, very, very broad, right? Like, it's like, okay, that's great. Like, what does that mean? So we use occupational therapy and treatment as part of a treatment. It's a part of a treatment, but it's our core value. But, there's research, and I could reference a bunch of different things. But basically, when you use occupation in treatment, it increases that translation into function. So basically, we use many different ways to achieve occupational performance. Okay. So we have lots and lots of theory, right? Like every other, physical therapist and speech and nursing and everyone else, you have this basis of theory. So you're using things like, looking at psychosocially, you're looking at biomechanical, cognitive, sensory motor components. You're doing, you have to look at the environment. How do we fit all that in to increase quality of life and participation in our daily occupations? Okay. So, we do things like preparatory activities is how we kind of distinct. We do preparatory activities, which is basically exercise, the basic exercise, strengthening, the very biomechanical foundation. So we use those types of activities to achieve that goal. We also use purposeful activities. So we may be replicating things in the clinic and saying like, okay, I have to be able to, get into the shower. Well, okay, if we don't have a shower in the clinic, let's replicate that. So it's purposeful or something that they actually enjoy doing. We have them participate in that. So if we're going to be working on dynamic balance, maybe we're working on, participating in a game activity, right? And physical therapists do that too. And then we also really focus on the occupational aspect. So really having them practice ADLs and that kind of thing. So what kind of gets hairy is we use a combination of that to achieve those goals. So like if someone can't, put on their shirt because they don't have enough internal rotation or they having, anterior shoulder pain or whatever it is, we may have to do modalities. We may have to do exercise. We may have to do range of motion. We may have to do, whatever we do. And then we're like going to be practicing that and say like, okay, we've increased range of motion. But we always want to kind of go back to occupation because that is what translates into function. So it's a whole different theory. And it's like, we look at so many components, just like physical therapists do. It's like, you're not just giving them exercise. You're not just assessing them and saying like, this is what they need to do, but you're looking at, proprioception and balance and all those other things that go into that. It's not just, I'm giving you a bicep curl. And we know that. And same with OT, people like, they're just teaching them to get dressed. But from an OT standpoint, we're looking at visual perceptual, like how the environment affects that. Maybe they have low vision and the room is honestly too dark, which increases, fall risk or whatever that is. And proprioception, they're having numbness. And so there's, we're really trying to focus on the big thing. And it's hard because our things like, okay, it's those little things that are important to people that increase their quality of life. Like you'll have goals, like what are your goals? Like what are, we go through the basic goals and they'll say basic, but then, you'll have crazy things like, I want to be able to roll my own cigarettes. Like, these are things that people tell us.
Right.
And you're like, okay, how do we do that? If that is what's important to you, like, honestly, we actually, those are things we actually work on. And it sounds crazy, but it's looking at what is important to the patient. Right. So yes, I mean, OTs have a kinesiology. We learn about kinesiology. We learn about exercise. We learn about cardiovascular. Like, we learn all of a lot of the similar things that a physical therapist would. And so, like I said, when you're like, PTs or OTs can't, do cardiac rehab, and you're like, what? How do you even say that? Or we can't do any, functional ambulation. You're like, okay, come on. Like, seriously, like it's that's where it gets great. And I get it. I see that. But and also, like, the insurance companies are really demanding, function be part of your goals. So it's really tricky because I know, like, PT goals are, focusing more on function. And so, like, OT is like, well, how do I distinguish myself? How do I, maintain what we're doing is, legit? Well, not legit in the eyes of a insurance company. So it gets really hairy. But, we're also looking, all sorts of things like cognition is such a huge component, and not only assessing cognition, but how do we translate that into everyday function and let it be through compensatory techniques, which everybody's familiar with, like, we're going to give a bath bench, or we're going to do those safety things. Great. That's great. But also, it's like, how do you do functional cognition, and how do we get them to actually get dressed when they don't have the, a higher level cognitive, they're not high cognitively. And then there's lots of techniques to do that. And so I think what I guess I'm saying is that OT is distinctive of PT, right? But we have those, overlapping areas. And so it's just, I think if people really understand of what every discipline does, you have a better, I think, respect for a discipline. I don't care what discipline it is. Nursing, surgeons, whatever. Sometimes you're like, oh gosh, what, like, the surgeon comes and says there's a diagnosis, and you're like, that's kind of not what I'm seeing. And you're just like, but it's just what your own, it's just trying to take ownership of your own discipline, and then being respectful and understanding what the other disciplines do. OTs work in mental health, and people are like, how do OTs work in mental health? Because they see a lot of times it's just as, ADLs and a biomechanical foundation. But if our core is to help people complete the functions of everyday life and live life to the fullest, have a good quality of life, that translates to many areas. So you work in mental health, and you're working essentially on, from a different theory standpoint, but you're still working on the foundations of people are having struggles with ADLs, they're having struggles with bill paying, they're having struggles with self-care, interpersonal communication, and, coping mechanisms and coping strategies. And, we're doing that. We're doing OT from a different, theory base. Yeah. So, I mean, there's just lots of different areas that we can work in. One of my internships, which obviously has been a long time ago, but I worked at a Wisconsin State Mental Hospital, and it was the most eye-opening because I wanted to work mental health, right? Like, that was like, I'm going to totally work mental health. And actually, a lot of the insurance companies have shut down just reimbursement for mental health services in general, which is just actually devastating. But I worked there, and it was the most amazing experience. I learned so much about myself, so much about the world, but also so much about, like, what occupational therapy's role is and how we can help so many different people. I worked in a forensic behavioral unit, so they had a criminal background, and some people were, like, sentenced there. It was just like this crazy, but it was amazing. It was great. But it's just like, OTs can work in so many different areas, working on using that core, like, what are we? I mean, community health, like I was saying, I kind of focused on community-based practice, but I mean, you can do everything from, like, homeless shelters to, driving rehab programs. And it feels like, is that the same, healthcare profession working in those two? I mean, it seems like opposite, right. But our goal is just to increase quality of life, and however that may look. So.
Right. I love it. Listen, occupational therapy rocks. I mean, it's so, when I hear all this, I'm like, yes. Like, that's exactly, and it makes so much sense, that it would, it would feel so great to me, because I'm looking at the APTA's vision statement right now. I'm like, this sounds like, I bet occupational therapists would love this too. So the American Physical Therapy Association, their vision statement for the physical therapy profession is as follows: transforming society by optimizing movement to improve the human experience.
Yeah.
So that sounds awesome and great. It's so broad. It's like you said, it covers, what does it even really mean? Actually?
You're like, yeah, that's exactly right.
That's exactly right. And so when I'm hearing, what you talk about with occupational therapy, and it sounds exactly the same.
Yeah.
And so what do you think? Do you think that occupational therapy would love that mission statement too?
I think overall, yes. I mean, right? Our ultimate goal is the patients and doing what the patients need. This is where like all the quote controversy comes over, and trying to figure out like what's OT's distinct value, because we're like, PTs, they're starting to add function, and, like we like to think we're quote, functional specialists in a sense, and that we're helping them function. And then it's like, well, physical therapy, that then they're turning into, their mission statements, or they're, because I understand it. I get it. It's not so one-sided. It's not just like, we're just going to do exercise and this is going to be amazing. It's like, you have to look at it from a holistic standpoint. And that's what like all the disciplines are trying to do. It just gets a little, foggy, I guess. And as a PT, you know exactly what your role is. And as an OT, I know exactly what my role is. And I'm like, I don't do the exact same thing as a physical therapist. Like, I mean, from the outside, it may kind of look like it, but I'm like, I know what I'm doing. But you're just trying to figure out what you're just, it's just trying to convince insurance companies. And I think a lot of times, and also that's one of the reasons why documentation is so, so important, that we're, making sure that, from an OT standpoint, that we are documenting everything. Everything the ultimate goals obviously has to be a functional activity. So let it be dressing or driving, or increasing communication so I can pay my bills at the bank, or whatever it is. But it gets hairy, because it feels like, requirements are changing all the time. And it's like, but if we can document, easier said than done, but if we can document what we're doing and why we're doing it and how it impacts our patients, and they, the patient's saying, yes, everything's getting easier. I'm having less pain. I'm able to do X, Y, and Z. I'm able to go socialize. I'm able to, whatever it is. If we can document that and reflect that, I think we're all going to be, quote, fine.
Yeah.
But
yeah.
It's hard, because you only have so much time, and honestly, sometimes you only have like 3 lines to do it on a piece of paper or on the computer. And like, there's so many barriers. So yeah, we all ultimately have the same goal. Like I said, I like to be idealistic. We all want our patients to thrive, and we want them to feel good, and we want them to have a life that they want, whatever that may look like. I think an acknowledgement and understanding of all the disciplines is just really helpful, because I've worked in some facilities that, therapists, OT, PT have a huge amount of say in discharge planning, which I feel like we should, because that's what we do. But some facilities, they're just like, it's not part of the deal. The doctor says, let's go. The social worker does this. And you're like, do you know that actually they have a cognitive level of blah, 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 and they actually can walk to the bathroom. They can actually go to the bathroom, but they need that blah, 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 whatever it is. And you're just like, actually, don't you want my input? But, it's just, every situation is unique, and every person is unique. Every patient's unique. Every interdisciplinary team is unique, and it's trying to overcome some of those barriers.
Yeah, it's true. But the bright side of that is that even though it gets hard, there are those who try to create resources to make it easier for clinicians, such as a learning lab with Seniors Flourish. So could you talk a little bit more about, if there's someone listening who is an occupational therapy practitioner, what do you get out of it?
Wow, that's a great question. No, I really created a resource that I felt originally that I felt I would have needed as not only maybe a new clinician, someone that feels burnt out and need new ideas, or someone that's transitioning. Let's say they worked in the school district, now they're working in home health or long-term acute care or something like that. And they just are like, okay, I need to brush up on some skills. So basically what the Learning Lab is, it's a monthly membership. I do training videos, treatment idea videos and that kind of thing. And everything is member derived. So I can think of 100 things that people would need and want, but I want to be able to address and educate and provide evidence-based resources for the questions that the members have. So they may say like, is there any, people are having shoulder pain, XYZ. Can we do, a treatment video on that? So I do two treatment or educational videos a week. We do a journal club, where they can earn professional development units. We have a community forum where we can have journal club discussions, or people can just have, questions about things that they're seeing, or they're like, I'm kind of stuck on this, and get some more ideas from other members. I'm trying to think of, so we just kind of have a little bit of everything. They can ask me personal questions, personally questions that they need. Let it be, if they're having like some professional issues or dynamics or something like that, I can kind of help with that or give them some resources for that. And then there's lots and lots of links to resources, patient handouts. It's like we have such limited time in the clinic, and you're like, I need a patient handout on XYZ, and you're digging. And part of it is, that's part of my job. I do it for you. So everything's organized and helpful. So It's all just kind of like in one place so people can really get some really good information and feel like it's almost, I kind of describe it as like an OT help desk in a way. Like I said, like I was saying earlier, it's like you say to a coworker, okay, I tried this X, Y, and Z. Do you have any other ideas? And we'll be like, okay, let's brainstorm. Or this is actually what the evidence says. Because when you're in school, you are pounded with evidence-based research, and you read the journal articles and you are up to date on what's going on. And then you start working. And maybe some people were way better about this than me, but there was a period of time that I'm just busy working, and I'm like so excited I'm done with school that you're just like, it kind of goes out the window a bit. But then you get to a point where you're like, actually, I need to know what's kind of going on. And so I think, especially with the journal club, it's been really great because, you get what the new research is out there and things like that, especially if you've been out for a while. But yeah, it's and part of that is our own professional responsibility to stay up to date. But I think it's easier said than done. People may be flipping through the AJOT or, American Journal of Occupational Therapy, if you get it, if you're a member, but I mean, like, you have to actually make an extra effort. And so that's part of my job, or what my goal is with the Learning Lab, is to take some of those barriers out and make it very easy and very accessible. And then also, like, the ultimate goal is to help others help their patients and like serve their patients to the best in their best ability. And so, like, we get stagnant. We all get stagnant, and you kind of fall into your groove. It's like when you go to a continuing ed course and you're like, oh my gosh, I have a million ideas. I can try this, I know what patient I can try this on. And you kind of get jazzed up again, because you have that professional bantering and learning, and you're trying to, absorb all this information. You're like, okay, yes, this is great. And so I just feel like in the long run, being able to serve patients period in a different way has just been so rewarding, and not really what I had planned in my OT journey, but it's been great. Yeah.
Awesome. That's really awesome. And so for any healthcare practitioner out there, regardless of their discipline, any final bits of advice over what you've experienced, over what you've learned in your career, just no matter what we do, if we just want to really improve the quality of our relationships with patients, because that's really what I'm hearing so much, is trying to improve lives of people and find what way you can do that. And so you've been able to adapt and find ways to really help people. And that's really ultimately what I feel from what you've talked about, is trying to find ways to improve the lives of people, period. And and whether it's actually directly or whether it's really helping the providers to do a better job, to be better, and to develop stronger relationships with patients. What just advice do you have for us who, whether we've been in our career and we're sort of teetering on that burnout phase and maybe listening to podcasts to try to spark us up, or if we're, say, getting into the career and we're ready to go, what sort of advice do you have?
It's really funny that your little catchphrase of the podcast is listening. What is it? Listening to your patients?
Yeah, truly listen, not only hear the voice of the patient. So,
yes.
Yeah.
And I actually think that is actually the key. I always use the phrase, it's like a adapted Covey quote, but basically it's listening to understand, not listening to reply. And that is, that is my core belief. If you can listen to understand your patients, your coworkers, other healthcare providers, if you can listen to really understand where they're coming from and why they're making these recommendations, or why, X, Y, and Z, you are going to have a better understanding of what your role is, and we can better serve our patients. If we're just listening to reply and be like, yeah, we're not going to get anywhere. Let it be for their patients, coworkers, healthcare providers, whatever. So listening to understand and not listening just to reply, I think, is like the key, because it just translates in so many different levels in the healthcare profession.
That's so awesome. Thank you for that. And so for our listeners, how can they reach you with any questions or comments?
Yeah. Oh, I love connecting with other therapists. ODPT speech. I think it's such an important part of our profession. And I just am very lucky that I get to do it on much regular basis with my website. But if M. Chamberlain at seniorsflourish.com, feel free to comment, ask questions, connect. I love it. So it's, I think, what we need to be doing just overall, just connecting and learning from each other. So yes, I'd 100%. Love if anybody wanted to reach out and has any questions for me. Feel free.
100%. Yeah, that's a big issue with social media, is that it really turns into these echo chambers where we're all just sort of talking to each other about the same thing over and over again, and not reaching out to those with just totally different experiences and seeing what we can learn from someone else who sees it a different way, or may have very different opinions, very different experiences. So that's awesome. And I'm really grateful for this. So thank you so much for coming on to the Voice of the Patient.
Oh, thanks, Zach.
Absolutely. So, and also, I'll have links in the show notes to Seniors Flourish. And so for our listeners interested in that, please go check it out. And there is a Seniors Flourish podcast.
Yeah, I love the podcast. Has been awesome. It's just like the exact same values and missions. It's just like getting it out there and learning from each other. So yes, check it out. Seniors Flourish podcast.
Boom. There it is. So great. Thank you. And to our listeners, thank you for listening to this episode. If you appreciate the Voice of the Patient, then please leave us a review on iTunes. If you have a story to tell as a patient or a provider or both, then please find us on Twitter at Zach R. Stearns, or find Dave Reed at DReedPT. Thank you again, and keep listening to the Voice of the Patient.
If you enjoyed this episode, go to thevoiceofthepatient.org, where you can find other helpful podcasts and blog posts that will show you how to improve healthcare through not only hearing, but truly listening to the voice of the patient. Thanks for listening. This podcast is brought to you in partnership with the Jaros Collective, a podcast network that's redefining old and equipping healthcare clinicians to better serve our aging population. Find out more at geroscollective.com.